I'm Da Costa Kutibwa Chibwatin, as nurse at Mansa Memorial Hospital and also a participant in the recently ended course, which is Health of Families and Social Groups. I think the course has been very impactful and helpful in the administration of our core duties here as clinical staff, because it has given us insight and understanding to what we have to do for especially pregnant women, preconception care, and then during conception and even post-conception. And so it has opened our understanding to certain things that we didn't know, and even things that we were doing wrong.
I thought it was going to be something very complex, but at Utah Faith made it so simple for us, and everything went on smoothly. One thing I learned and can't never forget is the use of Maxor. Here in Ghana, we always use Maxor for pre-eclampsia, but Faith made us realize that it's also used for preterm deliveries, and which helps in the brain development of the babies. So that is something I give plus to Faith for.
One thing I love about her is her level of patience. She'll get the time to explain everything to you when you ask her a question during class, to your satisfaction before she continues with the class. This period of time also has broadened my knowledge concerning the midwifery course as a whole.
And I would like to also talk about Dr. Faith. Wow, she's a very good facilitator. She's the type who will tell you that no answer is wrong. I quite remember when I wanted to say something for the first time on the platform, I was panicking, and she told me, "Sanusi, you are right. Just express yourself." And with what I've learned, I think there's going to be a huge change at my facility, because me being a public health nurse without midwifery background, now I've learned a lot about midwifery, most especially the prevention of eclampsia in pregnant women, which is very rampant in my area. And I think I've learned something. I've learned a lot that I will implement in my rendering of care to the people in my facility and in the community as a whole.
Generally, about the course, it has really impacted my knowledge, like fully. There were some things that I didn't know, but through the course, I'm now empowered. Something like Maxor, she mentioned that Maxor is given to preterm labor. I never knew. That was my first time hearing, because what I observed was, she said it really helps in the development of the fetus brain. I never knew. So even for that one, I was very thankful to her. It's really helped me.
There are a lot of things that I got to know through her and the studies we had. And it is going to help me improve in whatever services I'm rendering to our clients.
In fact, the program has been very impactful in the sense that some of us after school, we didn't really get the chance to learn much. But through the help of this program, a lot of things have been learned. And then talking about case studies that we did.
And I also gained deep knowledge of breastfeeding, which will help me educate my community members, most especially our mothers and grandmothers who took care of us when we give birth.
I really enjoyed the course because Dr. Faith's presentation was very good. Her style of teaching, I really enjoyed it. So I had much from the course that we did. Initially, I didn't pay much attention on some of the lab investigations, but now I know all the investigations matters. So I'm going to work with it and pay much attention, focus more on all investigations.
I knew how to manage preeclampsia. I also knew how to manage it well. But what actually helped me was how to prevent preeclampsia, how to help a patient who has developed pregnancy-induced hypertension manage it to prevent preeclampsia. That is to use 750 milligrams of aspirin for the client to help prevent preeclampsia.
I thought I was a midwife and maybe I knew all, but with this, I've gained extra knowledge about how to take care of my clients, especially about the risks of pregnancy. For instance, we learned something about preeclampsia, and in fact, I have now known extra things on how to really take care of my clients.
Comparing the Canadian system in health and Ghana's system of health, I think that there's a little bit of a difference in how we treat our patients. Even some of the medications they use there, we don't use here. So with Faith as our tutor, we learned a lot of things.
Was a very good facilitator. Faith taught us very well. Her explanations was very clear. She will give you a chance to express yourself. When she asks questions, she makes sure that you express yourself to the point that she will understand. And then she gives room for everybody to come in. So Faith was a very good facilitator, and she did very well for her. She taught us very well.
She was also approachable in the sense that she asked students to send mails to her after lectures. If we weren't okay with any topic, we could approach her and then she gave feedbacks that was okay. That really helped.
Faith actually helped us a lot with slides, with videos, and the videos were so packed. Sometimes I didn't even have to look at the slide. I only focused on the video because whatever we needed was in the video. So I think this program was really impactful, and I'm hoping that as the years goes by, we can still continue and have more effective learning skills. It will help us, and we are grateful for this program.